Well, welcome. This is the 6th U.S.-Canada Forum on Workplace, Mental Health, and Productivity, and the first international forum specifically focused on making suicide prevention a health and safety priority. We're so pleased that you have made time for this unprecedented event so that we could be with all of you. I'm Sally Spencer Thomas, AKA Tenacious One, apparently, of the Carson J Spencer Foundation, and I'm also the Workplace Task Force co-lead of the National Action Alliance for Suicide Prevention. I'd like to begin by thanking each of you for investing your time to be with us today on this critical issue. Suicide prevention is close to my heart, personally and professionally. I'm a clinical psychologist by training, and I'm also a survivor of suicide loss. I lost my younger brother, Carson, to suicide in 2004, and I've also experienced the crushing blow of depression myself. Carson was a 34-year-old business leader and entrepreneur here in Denver. He started a national insurance company at the age of 27 and was, by all accounts, very successful. But he had a secret that he kept from the world. And his secret was he suffered from bipolar illness. And in the end, I believe it was the stigma he experienced around his illness that was more responsible for his death than the illness itself. In our grief reaction, our family and his closest friends launched the Carson J Spencer Foundation in 2005 with the goal to find bold, gap-filling measures to prevent what happened to Carson from happening to others. As you will hear throughout the day, working-aged men, just like Carson, account for the majority of suicide deaths. This became an important gap for us to try to address, and suicide prevention in the workplace seemed like an obvious place to start. Our Working Minds program was launched in 2007 and is now not only on the best practice registry, but is being implemented in workplaces around the nation and in Australia. This leads me to our goals today. Our intention is to engage you as leaders, as professionals with influence, and as friends, people with friends and family who could be helped by the programs we'll discuss today. We will not only share information about proven strategies that can save lives, we will invite you to look at how you can personally take action. We want you to feel connected to this issue and inspired to tackle it together. Just based on the large number of people who are touched every year by suicide deaths and suicidal behavior, it's likely that most of us here today have had some type of personal experience related to this issue. Just by a show of hands, how many of you know someone who has wrestled with suicidal thoughts or gone through a major mental health challenge? How many have lost a friend, colleague, or loved one to suicide? Frequently, we feel powerless when this first happens. I know we went through that in our family. Shame can also tempt us towards silence, to avoid speaking of something so difficult and so seemingly insurmountable. But over time, many of us learn that there are tools and solutions, and above all, there are many others who have had similar experiences and who have developed approaches to their work. Today, we will hear from courageous individuals who have overcome their personal challenges, and from innovators with proven track records in making our workplaces suicide safer. Suicide prevention in the workplace makes good financial sense. I recently reviewed a report on the Australian Mates in Construction program prepared by the Hunter Medical Research Institute. In the state of New South Wales alone, suicide within the construction industry costs the community over $500 million per year. This is just one industry with less than 200,000 workers. A simple workplace suicide prevention program was found to have a cost-benefit ratio of 4.6 to 1. Another economic study found that general mental health programs in Australia saved employers $2.3 for every dollar invested. Good suicide prevention is a net saving to both the employer and the community. This is a historic moment in suicide prevention, and leaders are coming to the table to participate in unprecedented ways. Earlier this month, I attended the World Health Organization's launch of the first ever World Suicide Report in Geneva, Switzerland. And on Monday, I attended a briefing at the White House on the Obama administration's plan for making mental health promotion and suicide prevention a priority. I give a big nod to those leaders like David Litz and Paul Quinnett who have been working decades in this movement for this moment. Suicide prevention has become a global imperative. A global imperative which I believe we can advance today by sharing real-world success stories and planning how we might adapt and implement them in our own organizations. In closing, I'd like to thank some key people and reiterate our goals for the day. First and foremost, I am so grateful for for Larissa Herda and her team at TW Telecom for hosting, providing refreshments, and offering significant logistics support. Thank you also to Bill Wilkerson and the Mental Health International and the National Action Alliance of Suicide Prevention for their partnership in this effort. I'm eternally grateful to all the speakers today, most of whom came from out of state. Their dedication to making this high-level event purposeful and practical to all of you is quite remarkable. I'm also grateful for the Carson J Spencer Foundation staff, in particular Lou Turner and Jess Stolman, Rainey, who offered great assistance with the details. Finally, I'd like to acknowledge again the gift of time from all of our attendees. Thank you for making this a priority for your day. We have all been to conferences where important information is shared, but then taking a link to action and following up seems elusive. Our goal again today is to move beyond that. We'd like you to consider the many ways you can leverage your leadership and take role in this effort, both internally with your own workforce and externally in the communities where you work and live. Everyone can play a role in suicide prevention, and there is much work that needs to be done. You will notice that in addition to your agenda and roster, you will find a next step sheet. We hope that you will complete this and turn it into our staff when you leave, so that in a month or so we can continue to move this conversation forward.